Hello friends, welcome back. In this session we are going to discuss about grievous hurt, which is described under section 116 of BNS. Myself Dr. M. Srinivasan from Chettinad Hospital and Research Institute, Chennai. So knowledge about grievous hurt is important for a doctor to draft the wound certificate when the case comes to casualty, whether it is a case of assault or road traffic accident. At the time of discharge, doctor has to give wound certificate mentioning whether the injury is sustained or simple or grievous in nature, because that helps the police to file the case in the appropriate sections. If it gives a simple injury, there is a section for hurt, it can be filed. If he gives the opinion as a grievous injury, the punishment also higher, and the section also differs under 116 Bns, which gives a definition of this Bns. Sorry, this grievous hurt, right? So, what does hurt mean? Hurt means causing bodily pain or disease or infirmity to any person. This can be remembered by the mnemonic PID: P for pain, I for infirmity, D for disease. Pain, if you make a fist blow to someone, causing contusion or swelling, resulting in pain, or if the doctor gives without consent some penicillin injection, IM, causing pain to the patient, he may be booked under causing hurt to the patient, right? Causing disease means spreading the disease to other infectious diseases, contagious diseases, like that. Sometimes if the person who spreads the disease cannot be convicted under the section for hurt, that is 114 BNS, because the time interval between the time of infliction and the effect on the victim is prolonged. Sometimes court may not convict the person under causing hurt, but there is a separate section in the BNS, that is 271 BNS, which says spreading the disease negligently or unlawfully to any person. That is punishable up to 6 months imprisonment or fine or both. That is section 271. There in that section he can be convicted. Or causing infirmity to any person. Infirmity means in the books it is different definitions have been given, like inability of the organ to perform its function, or causing some unhealthy state of body or mind, or causing terror or hysteria to a person. Suppose you are wearing a ghost mask and inflicting terror on someone, you may be booked for causing hurt to the person, because that causes a mental terror to the person. Or infirmity is said to be like because this some unhealthy or ailment or sickness, inducing sickness to a person. Suppose a boy giving some sweet meat or a cake to his girlfriend. After eating that, she develops severe food poisoning with vomiting, diarrhea, all these. Then so she has not died, but she suffered a serious food poisoning symptoms. So boy is said to have caused a hurt to her under infirmity, right? So punishment for hurt is given under section. There are two sections dealing with it. One is 115 subsection 2 of BNS, that is causing hurt. 115 subsection 2 of BNS with a punishment up to 1 year or fine up to 10,000 rupees or both. Suppose the hurt is caused by dangerous weapons or by dangerous means, then the punishment is up to 3 years imprisonment or fine up to 20,000 or both. That is under section 118 subsection 1 of BNS, right? Simply causing hurt, 115 subsection 2 of BNS. With the dangerous weapons or means, that is punished under section 118 subsection 1 of BNS. What is dangerous weapons or means? Any idea? Dangerous weapons means any instrument used for shooting, stabbing or cutting, or any instrument which one used as a weapon of offense is likely to cause death. This is the definition. Dangerous means that implies, fire or any heated substance, poison or any corrosive substance, any explosive substance, or any substance which is harmful to the human body to inhale, to swallow, or to receive into the blood, or by means of any animal. This is the description given for dangerous means. So by any dangerous means or dangerous weapons the hurt has been caused, then the punishment is enhanced up to 3 years or 20,000. That is 118 subsection 1 of BNS. Now the hurt, for convenience we can classify it as either simple hurt, which is synonymously used as simple injury, though there is no legal definition of simple injury in the law books. Right? Only hurt has been defined. So for convenience, simple injury can be defined as which is neither serious nor extensive, and one which heals rapidly without leaving any permanent disfiguration or deformity. Which is neither serious nor extensive, heals quickly without leaving any permanent disfiguration like scar formation or permanent deformity to the victim. Those injuries are called simple injuries. In contrast to grievous injuries, which may take more time, which often leaves permanent disfiguration, right? Like that, they are even serious also, right? They may likely to cause death also. All these, they may endanger life, those injuries. In other words, as far as drafting a wound certificate in consent where we have described the injuries are simple or grievous, simple injury can be said as those injuries which are not grievous, simple. Because grievous injuries description has been provided in 116 Bns. Simple injury has not been defined. So simple injury can be considered as those injuries which are not grievous, right, or fatal. They can be considered as simple injury for filling the wound certificate purpose, right? Second type of hurt is the grievous hurt. Again, we can synonymously use for filling the wound certificate as grievous injury, right? Grievous, while saying, that is the proper pronunciation. Often we students, grievous with the spelling as Grievous, that is wrong. Grievous, that is the correct spelling. Don't make mistake, and it should be pronounced as grievous injury, which is mentioned under section 116 of BNS, previously section 320 of IPC, right? There are 8 classes provided here. So if the doctor sees any injury which fits in any of those 8 classes mentioned in that 116 BNS, he has to say the injury is grievous. If the injury does not fit in any of the classes as prescribed under 116, it should be called as simple injury. It should not be as a subjective assessment. Since the injury is larger, you cannot say it is grievous. Or some people have the concept of all the injuries are grievous. Better go for grievous so that we can let the court change in the trial. We should not be tortured by the court that why you put simple as grievous or grievous as simple. Have you taken money? Since it is grievous, but I think you have taken money from the accused, and we converted the grievous as simple. So better put all the injuries as simple, that grievous, like that also they are making errors. So for classifying injury as simple or grievous, doctor has to be familiar with all the classes and the meaning of those classes as mentioned in 116 BNS. First class says emasculation. This is the class pertaining to male sex only. What is emasculation means? Depriving the male of a masculine vigor or masculine power. That is, penetrating power during intercourse is lost. It can be affected by total amputation of penis or removal of both the testicles before puberty will make the person both impotent and sterile. But if both the testicles are removed after puberty, they are also often Certainly the sterility will be there, but sometimes potency may be retained, because potency is said to be learned sexual behavior. So maybe having the potency sometimes. Removal of one testicles either before or after puberty does not affect either fertility or potency, right? Removal of flaccid penis, that also uh, considered as a grievous and hurt, but not under this class. That is a separate class, class 4, that is under member it comes, right? Suppose one testicle only removed, which is not important, it does not cause importance, so you cannot say it is coming under emasculation, but that is a member. Testicle is a member. Again, under class 4 of grievous hurt, you will be punished for privation of member, right? Member or joint. Good. So emasculation can be done by various means. These are all direct means, I mean. Indirectly, by causing injury to the L1, L2 vertebra, thereby damaging the parasympathetic outflow with damage to S2, S3, S4 parasympathetic nerve roots. You know, P for penile erection, P for parasympathetics. So S2, S3, L4, S2, S3, S4 nerve roots are damaged, secondary to fracture to L1, L2 vertebra, right? So there also the potency is lost, right? Coming to second class, that is permanent privation of sight of either eye. Permanent word is important. Privation means a loss, right? Sight of one or both eyes. It can be done by various means, like with the fingers or thumb gouging out of eyes, poking the eye with any sharp instrument, or throwing acid onto the face, that may cause permanent blindness, or a person causing a corneal scarring, right? Corneal abrasion, that may lead to unhealing, corneal scar. If that corneal stromal layer is involved, that deeper corneal abrasions involving the stromal layer of the cornea may end up with corneal opacity. Corneal opacity is secondary to corneal scarring, leading to partial or total loss of vision. If you leave the injury as such without medical or surgical intervention, if it end up with a permanent loss of some diminution of, it's not required total loss of vision, some partial loss of vision, if it is permanent without surgical or medical intervention, if you leave the injury as such, if it end up with that permanent privation of sight of one or both eye, it should be considered as grievous sight. In that situation, the corneal scar leading to corneal opacity may be cured with corneoplasty, and vision can be restored, but a doctor should not take that into account. As I told, any medical or surgical intervention should not be considered. You have to presume without any intervention or aid, what will be the outcome, right? If there is any, so after healing, doctor has to wait till the healing has to occur. So doctor can inform the police in that situation. Second examination is required. Doctor may give sufficient time. After this, you have to check again the eye. Any dimness of vision, partial loss of vision is there, then he has to give opinion as grievous hurt. No loss of vision, then it should be considered as simple injury, right? Permanent third class is permanent privation of hearing of one or both ears. Permanent privation of hearing of either ear. Suppose while ragging, you might have known, right? Nowadays, a huge blow or slap over the ears may cause a rupture of tympanic membrane and a loss of hearing. Usually one ear, usually on the left side, right? That is privation of hearing of either ear. Again, usually small central perforations of tympanic membrane may heal usually in 3 to 4 weeks. So in that situation, doctor has to wait, examine after 4 weeks. If it is healed completely with the closure, he restores hearing. So it is a simple injury. Doesn't heal, it should be considered as grievous hurt, though The tympanic membrane damage can be restored with a tympanoplasty, like corneoplasty. Again, surgically it can be corrected, but doctor, for this legal sake, he has to say it is a grievous cut. If you leave as such, there is no spontaneous healing, then it should be considered as grievous cut for practical purpose, right? So it can be done by poking the ear with any instrument, causing injury not only to the tympanic membrane, ear ossicles, auditory nerve. So any means we can cause this hearing loss, right? So by audiometry, you have to check that whether how much hearing loss is there, right? Audiometry may be helpful in that. Fourth class is privation of any member or joint. Privation, as I told, what is the meaning of privation? It is loss. Here member means any body part or limb or organ which has its own destined or specified function. For example, eye is a member, ear is a member, nose or nostrils is a member, lips is a member, or mouth is a member, right? Even fingers, hand, all are members, right? So privation, removal of, suppose a boxer by the bite off his one ear like Mike Tyson did, then it is considered as a grievous cut, because though there is no loss of hearing here, but it will cause a privation of member. Of course, it causes permanent disfiguration of head or face also. Chopping off of nostrils or pinna, all these may cause disfiguration of face also. So there in the class 6 also, it will be punishable. Privation of joint, any joint, privation of any joint at the any distal interphalangeal joint, that is amputation occurs, that also considered as grievous cut. Joint means the place where two or more bones unite and muscles along with the muscles, right? Fifth class is destruction or permanent impairing of powers of any member or joint. Destruction or permanent impairing of powers of any member or joint. Here member or joint is there, but power is lost. Suppose you are causing head injury. Patient suffers from hemiplegia or hemiparesis. You are causing injury to the spine, injury to the spinal cord. Quadriplegia occurs or quadriparesis occurs, or paralysis of foot occurs, something like that. You are cutting the tendon, like a flexor pollicis longus tendon. The patient cannot move the thumb. He cannot hold the tumbler. He cannot write using pen, like that. So member is there, function is lost. Suppose you are causing a burn injury in the joint areas. On healing, severe contracture occurs, impacting the joint movements. So power of joint is lost here, right? So any scar contractures, injury to the muscles, injury to the tendons, injury to the nerves, anything impacting the powers of that member or joint, that is. Or you are taking a hammer, making a huge blow on my thumb, causing it a pulpy organ, right? Pulpy, it become pulpy due to huge blow by the heavy hammer. So member is there, but it cannot be used. Power is lost here. So all these coming under grievous cut. That is why removal of flaccid, this penis, that also becoming this under class 4 here. Here it is class 5, right? Coming to sixth class is permanent disfiguration of head or face. Sixth class is pertaining to face. Permanent disfiguration of head or face. So how it can be done? Permanent disfiguration. Vitriolage, that is throwing of acid. Throwing of acid cause grievous cut by, including multiple classes here, like permanent this loss of sight of either eye, permanent disfiguration of head or face. Under class 8 also, it endangers life because it causes severe pain leading to death due to pain shock. So it is a endangers life also. So multiple classes will apply for that. So branding a female cheek. Branding means inflicting some symbols with a hot iron rod like that, inflicting burns injuries leading to permanent scar formation. So that will cause permanent disfiguration of head, throwing of acid. Not only acid, any corrosive substance which may cause burns to the face. Here it is a gender neutral. It's not pertaining to female, both male and female. Age also not considered here. Causing scar to a 18-year-old unmarried actress or an unmarried woman, or causing injury which may end up with scar formation to a 90-year-old farmer woman, which is a coolie. Court may differ with respect to quantum of punishment, but as doctor, we should not go for any subjective assessment, whether it is an actress affecting her professional life or personal life, or is a 90-year-old whose face is already with a lot of creases. A small scar may not be that much evident to make her ugly, right? So disfiguration means a change in configuration or facial appearance, right, without weakening the person. That is the definition of disfiguration. So head or face, causing a laceration or cut injury in the scalp also, which may end up with this scar formation. Right, clear? Any injury end up with a scar formation. That may be, again cured with plastic surgery, and our scar may be removed. But if you leave the injury as such, if it end up with a scar formation, however small scar, it will be in the face and head of either male or female, irrespective of the age. That should be considered as grievous hurt. Clear? Right. Let the court decide. Fracture or dislocation of bone or tooth. Fracture means any disruption in the continuity of the normal anatomic continuity of the bone. So even a hairline fracture involving any bone or involving only the outer table of the skull, all will be considered as, for practical purpose, as it need not be through cut, entering into medullary cavity is not required. So even hairline fracture should be considered as grievous hurt. Fracture or dislocation of a bone. Dislocation of a bone, shoulder joint dislocation, again which can be reduced within a minute, but since it causes severe pain to the patient, we have to say it as a grievous hurt, right? Sometimes the patient may be having a recurrent spontaneous dislocation of shoulder also. That should be ruled out. Sometimes he may pretend like this caused with the assault. He may be having the history of a frequent recurrent spontaneous dislocation. That also has to be ruled out. Then tooth is a fracture of the tooth. Even fracture of enamel also is considered as grievous hurt. Okay, partial or total fracture, right? Dislocation of the tooth, which is a very good, healthy, strong tooth. If due to fist blow or assault, if there it is a loosening of the tooth occurs, that should be considered as grievous hurt, because that causes again severe pain and all. So we have to rule out again here. Previously, any looseness of tooth is there due to any disease of the gums, gingivitis, whatever, caries tooth like that. Previously loosened tooth, again loosening should not be considered. Healthy, well-fit tooth, if there is any dislocation or fracture, it should be considered as grievous hurt. So both bone or tooth, right? Last but not the least class is containing three subclasses. One is any hurt which endangers life. Second, which causes a sufferer to be during the space of 15 days in severe bodily pain. Or class 3 is for 15 days he is unable to follow his ordinary pursuits. Right? Previously under section 320 we can easily remember for 20 days it has been mentioned, 320-20. Here now it has been changed under 116 Bns as 15 days. So any hurt which endangers life. Endangering life means may cause imminent death, that injury. For example, a stab injury over the chest, a penetrating injury into the skull, right? A huge blow onto the right hypochondrium may rupture the enlarged liver in case of alcoholics, some of these, right? So any hurt which endangers life, squeezing the testicles, that may cause a vasovagal shock, right? So, or cutting the radial artery, patient may go for profuse bleeding. Any bleeding which is more than 1 liter of the blood, that should be considered as endangers life, right? Or any injury which is having the chance of 50% fatality, that also we can say as a grievous endangering injury, endangers life, right? For possessing, posing imminent danger to the life of the person. Injury should be of that. Stab injury into the abdomen, right? Or which causes a sufferer class 2 now during the space of 15 days in severe body pain. But it is a subjective symptom. Patient may say he is suffering from severe body pain. So it is the doctor's duty to apply his medical knowledge. Whether the injury, gravity of the injury is of such a nature, in normal person it will give rise to severe body pain prolonging for 15 days. So it can be assessed by keeping a CCTV in the room and silently observing. In the absence of doctor, he is normal. Simply, it's the presence of others, he may be screening, pretending with severe pain, all this. Level of pain can be assessed with a standard pain assessment, that charts are there with the facial expressions. Patient that pain assessment can be done. If it is severe pain, he may point that in the chart, standard pain assessment scales are there that can be used, but it should be for 15 days. It need not be continuous. Sometimes 10 days severe pain, 2 days pain free interval, again he may be suffering for another 5 days. So he should be considered as grievous hurt as per this class, like this. So severe bodily pain and unable to follow his ordinary pursuits for again 15 days. During the space of 15 days, he should not be able to do his ordinary pursuits. What is ordinary pursuits? Yeah, very good. It is not job related, it is profession related. Like a driver, he cannot drive the car, right? Affecting his daily normal duty, starting from bed to night, like attending to toilet, taking bath himself, right? Combing the hair himself, eating the food with his own hands, dressing, putting button, unbuttoning of his shirts. All these are impaired. He cannot move the limb. He is bedridden like that for 15 days. The injury is of such a nature which affects his ordinary pursuits, which should be considered as grievous hurt. Is clear? So these are the 8 classes. Punishment for grievous cut is concerned. It is described under section. Simply causing grievous hurt is as per 117 of BNS. That is, punishment is up to 7 years imprisonment or fine or both. Along with the fine. Up to 7 years along with the fine. As per 117 subsection 2 of BNS. 117 subsection 2 of BNS. Right? Suppose he causes injury leading to persistent vegetative state of the victim or permanent deformity occurs, then the punishment is higher, right? With minimum 10 years imprisonment up to life imprisonment. Like Arna Schanbach case, he caused injury leading to permanent vegetative state, like that. Then the punishment is minimum 10 years up to life imprisonment. Life imprisonment here means a person has to spend the remainder of his life till death in the jail. Normally life imprisonment in other circumstances means it is 14 years. Here it is remainder of the life, persistent vegetative state. Okay, causing a grievous hurt with the help of dangerous weapons or dangerous means. That is described under section 118 subsection 2 of BNS. Subsection 1, causing hurt with dangerous weapons or means. Subsection 2 of 118, that is grievous hurt with dangerous weapons or means. Here the punishment is 10 years, even up to life imprisonment can be given. 10 years to life imprisonment can be given, along with the liable for fine also. So this is one thing. So if you throw acid, that is throwing of acid into the person, as that is described under section 124 subsection 1 of BNS. Throwing of acid is punishable with a minimum 10 years to maximum life imprisonment 14 years, and the fine amount will be fixed by the court to meet the medical expenses of the victim. That fine amount will be handed over to the victim's treatment, including plastic surgery, whatever may be. So that will be, collected from the accused. So 10 to 14 years imprisonment. 124 subsection 2 BNS deals with attempting to throw acid. Either throwing acid or attempting to throw acid. Even if the person attempt to throw acid also is punishable with half of the punishment prescribed under section 118 subsection 124 subsection 1, that is 10 to 14 years life imprisonment. Here 5 to 7 years imprisonment along with the fine, right? So these are the punishments. So I hope you understood these 8 classes, right? So these are the memory aid to remember the 8 classes of grievous hurt. That is, every student has remembered injuries definition but forgot it within 15 days of passing examinations. Here E stands for emasculation, S for permanent privation of sight of either eye, H for hearing, that is permanent privation of hearing of either ear. Then remember that member stands for privation of any member or joint, I for permanent impairment of powers of any member or joint, whereas D stands for that is permanent disfiguration of head or face, F for fracture or dislocation of bone or tooth. Then there are 2 P's actually here. So any hurt which endangers life. There the exams E stand for endangers life. Then 2 P's are for one for during the space of 15 days patient should be in severe bodily pain, right? And another P is for during the space of 15 days he cannot perform his ordinary pursuits. That is for 15 days. With this we can remember these 8 classes, and another memory aid is this eat 3 pears daily, purely free advice for 15 days. Here E stand for emasculation. Then there are 3 P's here. One is for permanent privation of sight of either eye, permanent privation of hearing of either ear, privation of any member or joint. D for destruction or permanently impairing powers of any member or joint. Then 6P for permanent disfiguration of head or face. Then F for fracture or dislocation of bone or tooth. Then lastly class 8, that is any hurt which endangers life or which causes a sufferer to be during the space of 20 days in severe bodily pain or unable to follow his ordinary pursuits, right? So with this we have come to the end of this discussion. But here I would like to stress that again, doctor giving the opinion as a simple or a grievous is to guide the law enforcement agencies only to file the case in appropriate sections, as well as to guide the court. It is ultimately for the court to decide whether the injury is simple or grievous. Often the court have changed the grievous injury as given by the doctor into simple and vice versa. So depending on the circumstances of the case, the age of the victim, and this gravity of the injury, court may alter the opinion given by the doctor. So doctor's opinion is not the final one. We should understand. So with this, I hope you have understood the concept of grievance hurt. We will see with the wound certificate in the next video. These are the references and I thank all the authors of the book. Thanks for watching. Bye.